Meanwhile, the nurses' strike has entered the second day in Nakuru County after the health workers join their health counterparts at different counties. And Marianne Nyambura is there checking on the situation with the public hospitals. Marianne, where are you? Which hospital is it and what is the situation like?
Good morning, Sam and Zinzi, and indeed we are here at the Nakuru Level 5 hospital, whereby we understand that operations are slightly paralyzed. Reason being, as you can see, people are still flocking in, patients and others who are bringing in their loved ones here. They're flocking in to receive services here, but what we understand is that operations have slightly been paralyzed, especially in the eye unit department. So what we know so far is that we have been able to gather reports is that there's a section of the nurses who are at work right now, but what you understand is that they are on contract, but those who are employed on a permanent basis are not operating right now. So yesterday we understand that the Nakuru nurses joined 7 other counties, including Busia, Bomet, Siaya, Tana River and Kakamega, in just trying to make sure that the CBA that has been stalled for the past 1.5 years is implemented. So for them, they are simply saying that they are not returning to work as at now. But with me here is Ogeto, who will just shed more light. He's mentioned that operations here, the fact that our operations here have been paralyzed has affected one of their patients. Ogeto, kindly join us here and tell us what is the situation like for you and your family?
We were to bring in one of our patients. That was on Sunday. So when we discovered it, they told us they are going out for a strike. So we were forced to relocate our patient to a private facility. So that's where now she's being attended. And we are not happy with what's happening. And as the people of this county, we could have wished, because health, as one of the key areas mandate wananchi they are supposed to be receiving, we don't see the counties driving as well on the issues of health. If the worst becomes the worst, we think of the proposed referendum, then the deeds to do with the health should be transferred back to the national government.
Let me ask you a question. At what cost will this strike cost you?
So much, because private they need to spend. At times we don't have our updated cards at times, and sometimes there are things that you can pay by the card that you must pay cash. So we are frustrated because we must raise funds to take care of these things. We are worried if this is the situation, and the same situation will go for quite some time. We are wishing that the national government, the president and the county government to consolidate by consulting. We make sure if there are issues we need to work out. My wish, 100% wish, can health be transferred back to the national government. We are very comfortable to do that. Yes.
Yes. Thank you for that. And well, Sam, this is the situation here. As I mentioned earlier, the eye unit department operations there have been paralyzed. But what you understand is that the governor, Lee Kinyanjui, issued a statement this morning asking the nurses, the over 1,300 nurses, to return to the table, so that for them, or rather for them to have a deal concerning this. Also, what we know so far is that 6.2 billion was allocated in the 2018-2019 budget to the health sector. Now, out of this, 3.9 billion goes to the Human Resource Department, therefore questioning what could possibly go wrong in this county. Back to you, Sam.